webinar titled The Healthcare Law and You, How Does the ACA, or the Affordable Care Act, Help Asian Americans, Native Hawaiians, and Pacific Islanders in Region 10, Alaska, Idaho, Oregon, and Washington. Thank you so much for joining us this morning. We have an awesome opportunity to learn more about the Affordable Care Act and what is it doing for our communities. But first, I'm Franco Chamakili. I'm a policy associate at the Asian and Pacific Islander American Health Forum, located in Washington, D.C.'s office. Today, I just want to talk a little bit about our panel. We have an awesome, diverse panel representing the Health and Human Services and also the Asian Pacific American community in Oregon. Our speaker from the Health and Human Services is Regional Director Susan Johnson for Region 10, which encompasses Alaska, Idaho, Oregon, and Washington. And then following her, we'll have a presentation by Reverend Joseph Santos-Lyons, the Director of Development and Policy from the Asian Pacific American Network of Oregon, or APANO. And just to start, before I turn it over, we have a few housekeeping items. So you'll see, if you have a question in the right-hand column, you'll see there's a question box. You can type in your question at any time during this webinar, and we will try to address all questions at the end during the Q&A session. In addition, we are recording this webinar, and it will be shared on our website, apihs.org, after it's been cleared by Health and Human Services and also the White House Initiative. In addition, this webinar is closed to the press. And without further ado, I'd like to hand it over to Regional Director of Region 10 for Health and Human Services, Susan Johnson.
Thanks, Franco. Thanks, everybody, for joining this webinar today. It's a pleasure to join you, and it's a privilege to serve in this capacity as Secretary Sebelius's representative and this administration's representative in Region 10, which we've said is Oregon, Idaho, Alaska, and Washington. We're going to go through some slides today highlighting the aspects of the Affordable Care Act, now law, that have quite a bit of influence on improving the health status, access issues for Asian American and Pacific Islander community. We know at the outset that not all Americans have equal access to health care. We know that low-income Americans, racial and ethnic minorities, and other underserved populations often have higher rates of disease, fewer treatment options, and less access to care. We know also that these folks are less likely to have health insurance than the population in a whole. And for example, 1 in 6 Asian Americans are either uninsured or underinsured. I'll be talking today about the Affordable Care Act and the improvements it makes in these areas. I want to mention, just as an aside, there was a Seattle Times article on August 13th that was timely and brought up many of the issues I want to talk with you about today and discuss particularly the need for increased advocacy for cancer screenings for Pacific Islanders. So if you haven't seen that, I'd encourage you to go to the Seattle Times archives from August 13th. At HHS, we're working hard on implementing and communicating all that this law means, and we need your help to do that. We're here to be partners with you in the community and hope that you'll be able to share the information today with your friends, neighbors, and others who need to know life-changing aspects that can affect them. There are a lot of parts of this law, a lot in place now, a lot still coming, and it's difficult to cover everything in 15 minutes. So before we start, I just want to mention that questions can also be answered and more details are available at www.healthcare.gov, and we'll say that again at the end, where you can find all the specifics hopefully you need to know about aspects of the law. Next slide, if we go to the next slide, it should say the problem at the top. It's always good to know, so what was this law trying to fix? What were the needs? What is the problem? And you can see with the bullets on this slide, the answer before us was that the health insurance market worked well for a few big insurance companies, but not so well for most American families. Insurers could pick and choose who they gave coverage to. And in total, 50 million Americans were uninsured, and tens of millions more had coverage that didn't cover critical treatments and preventive care. Overall, we estimate that 18.1, that's almost 20% of Asian Americans and Pacific Islanders are uninsured, compared with 16% of all Americans. So much to be done there. Next slide, please. Prior to the passage of the Affordable Care Act, the United States spent more than 16% of its gross domestic product on health care in 2009. And without reform, the nation's already excessive spending would have reached unsustainable levels. So quite frankly, what we had wasn't working. And according to a new study that you can see on this slide called Dying for Coverage, the Deadly Consequences of Being Uninsured, 26,100 people between the ages of 25 and 64 died prematurely due to that lack of health coverage in 2010. Next slide. This famous picture of the President signing the Affordable Care Act reminds us how far we've come in the years since that action. Some of the reasons why the passage of this act is particularly important for the Asian American and Pacific Islander community, and why Congress worked so hard and the President signed it in March of 2010. Since that time, healthcare spending is growing at a slower rate. Premiums are growing at a slower rate. The decline in small business offerings health insurance coverage has stopped, and the solvency of the Medicare Trust Fund has been extended. Next slide. The Affordable Care Act puts in place comprehensive health insurance reforms that you can see detailed here, expanding health insurance coverage, holding insurance companies accountable, guaranteeing choice and control for consumers, lowering costs by making healthcare more affordable, enhancing quality healthcare, and improving public health, including an unprecedented focus on prevention at all levels. Next slide. The first main way that the law helps you is creating a new Patient's Bill of Rights that protects everyone from those insurance industry abuses of the past. In the past, insurance companies could take advantage of you. They could deny coverage to children who may have had asthma or born with a heart defect. Insurance companies can no longer deny coverage to children because of any pre-existing condition. Insurance companies could also put a lifetime cap on the amount of care they would pay for. That no longer is possible. And worst of all, they could cancel your coverage when you got sick, just when you needed it most, by finding an accidental mistake in old paperwork when you signed up for your plan. Next slide, please. The second way the law helps you is by bringing down healthcare costs and making sure your dollars are spent wisely. You might hear something called the MLR, or the medical loss ratio, that was created by the Affordable Care Act. And it means that insurance companies are required to spend 80 to 85% of premium dollars, your dollars, on medical care and healthcare quality improvement rather than on administrative costs or advertising. Insurance companies that did not meet this 80-20 standard were required to provide policyholders with a rebate in August. And hundreds of people across the country and across our region, thousands of people received that rebate. In this year alone, 12.8 million Americans are expected to receive $1.1 billion in rebates or reductions in future premiums from their insurance companies. That would be an average of $151 per family. Next slide, please. We know that over the last decade, premiums have grown 3 times faster than wages. That's unsustainable. And that's why also the law has new rules to require insurance companies for the first time ever to publicly justify any rate increase of 10% or more. The Affordable Care Act brings an unprecedented level of scrutiny and transparency to health insurance rate increases. And in every state, every proposed increase of 10% or more will be evaluated by experts to assess whether it's based on reasonable cost assumptions and solid evidence. Next slide. The law also provides special relief for small businesses. They're the engine of the American economy and create 2 out of every 3 jobs. But in the old system, the mom and pop shop on the corner paid an average of 18% more for the same health coverage as the big chain down the street. This health care law gives small businesses tax credits to help them afford coverage. And under the ACA now, small employers with fewer than 25 equivalent employees and average annual wages of less than $50,000 that purchase health insurance are eligible for a tax credit, up to 35% of their contribution toward the employee's health insurance premium. Starting in 2014, the small business credit goes up to 50%. Next slide, please. The third part of the law is a set of improvements that increase your access to affordable care. Now, under the law, most young adults who can't get coverage through their jobs can stay on their parents' plans until age 26, a change that has already allowed 3.1 million young adults to get health coverage and given their families peace of mind. Of these young adults who benefit already, more than 97,000 are Asian American and Pacific Islander. Next slide. Under the old system, no one got a worse deal than 129 million Americans with a pre-existing condition. This health care law has given Americans who've been locked out of the market for their pre-existing conditions a new coverage option called the Pre-Existing Condition Insurance Program, or PCIP. More than 67,000 Americans who've been locked out of this insurance market because of that, conditions like breast cancer or heart disease, now have health coverage through the PCIP program. Next slide, please. The law is also expanding access to preventive care. You can see the check marks on this slide. Many kinds of services available now that were not available before. The services that many insurers are now required to cover with no cost sharing include the items you'll see on this slide, including potentially life-saving activities to check blood pressure and cholesterol, diabetes screening, pap smears, mammograms, as well as flu shots for children and adults. As I mentioned before, cancer screenings are particularly important for Asian Americans and Pacific Islanders who are less likely to undergo mammograms, pap smears, and colorectal cancer screening. So again, a wonderful new benefit that we hope is spread far and wide through the community. It's also important for Asian Americans who are less likely to be tested for HIV/AIDS. The increased access to affordable care is also important because Asian American children are most likely to have had no health care visits to an office or clinic in the past year. An estimated 2.7 million Asian Americans and Pacific Islanders with private insurance currently have access to these expanded preventive services with no cost sharing due to the Affordable Care Act. Next slide, please. The fourth key way healthcare helps Americans is by making Medicare stronger. It makes, again, these kinds of key preventive services available with no co-payments or deductible to help ensure seniors don't skip a potentially life-saving cancer screen because they can't afford it. The 867,000 elderly and disabled Asian Americans and Pacific Islanders who receive health coverage from Medicare also have access to an expanded list of preventive services with no cost sharing under the Affordable Care Act. Second, it gives beneficiaries in the donut hole a 50% discount on their covered brand name medications. And third, the law provides a historic boost to efforts to crack down on Medicare fraud. In 2010, those efforts returned a record $4 billion with a B dollars, and the law gives law enforcement even more tools to go after those who steal from Medicare. Next slide, please. Looking down the road, the law includes a few important rules set up to protect you and look out for your best interests as a consumer. In 2014, there will be no turning anyone away because of pre-existing conditions. As mentioned before, that now pertains to children. No charging women because they're women. Insurers will not be permitted to impose annual dollar limits on essential health benefits. There are significant tax credits on a sliding scale for middle-class families. There will be better access to Medicaid, and members of Congress will buy their coverage in exactly the same kind of marketplace that you do. New estimates suggest that 2 million Asian Americans who would otherwise be uninsured will now be covered or eligible for coverage through the expansion of Medicaid eligibility and the creation of the affordable insurance exchanges. Next slide, please. We see that an affordable insurance exchange is a mechanism for organizing the marketplace for insurance to help consumers and small businesses shop for coverage in a way that permits easy comparison of available plan options based on price, benefits and services, and quality. Exchanges will also increase competition among private insurance plans through this comparative shopping and more informed consumers. It'll provide one-stop shopping and make purchasing of health insurance easier with providing consumers and businesses tools to compare benefits, pricing, and quality. Exchanges will create a health insurance marketplace that will allow employers and consumers to choose from plans offering high-quality benefits. Individuals and families purchasing insurance through the exchanges may also qualify for tax credits and reduced cost sharing. According to the law, the exchanges must be operational by January 1st, 2014, and the state must apply for approval just coming up by November 16th this year to the Secretary of HHS. Next slide, please. In 2014, taxpayers with household incomes between 100% and 400% of the federal poverty level will be eligible for premium tax credits for coverage purchased through the exchanges for themselves and members of their family who are not eligible for other health care coverage. The Treasury Department proposed regulations will outline eligibility standards for this premium tax credit and how credits will be calculated. Next slide, please. In addition to expanding access to preventive, affordable care, other efforts to reduce disparities include coordinated care. There will be new investments in community health teams to manage chronic disease, strengthening cultural competency in health care. There will be initiatives to strengthen training among healthcare providers to provide and respond to the particular experiences and needs of Asian Americans and Pacific Islanders. There will also be new data collection standards to better understand the causes of health disparities and evaluate progress toward eliminating them. We need better data so we can better understand the groups that we all collectively will be working to inform and enroll in the new health insurance exchanges. Next slide, please. In addition to preventive care and addressing insurance discrimination, which I spoke about earlier, the Affordable Care Act will help reduce disparities by making improvements in expanding healthcare workforce, increasing funding for community health centers. The Affordable Care Act established the Community Health Center Fund that provides $11 billion over a 5-year period for the operation, expansion, and construction of health centers throughout the nation. Approximately 700,000 of those who use a health center are Asian American or Pacific Islanders, and the numbers served by the health centers is growing. The HHS Action Plan to Reduce Racial and Ethnic Disparities outlines goals and strategies and actions that HHS will take to reduce health disparities among racial and ethnic minorities. Recent Asian immigrants and Pacific Islanders are underrepresented in the healthcare professions, and educating populations about the loan repayment program so that we can get more folks into this underrepresented profession is recognizing the correlation between culturally and linguistically competent care and patient satisfaction. Next slide, please. Finally, millions of Americans, including women, families, seniors, and small business owners, are benefiting from the Affordable Care Act. without the Affordable Care Act, if we were to rewind the tape to 3 or 4 or 5 years ago, 3.1 million young adults would lose their insurance coverage. Nearly 105 million Americans would be vulnerable again to having lifetime limits. And nearly 75 million Americans wouldn't know if they're receiving value for their health insurance premium dollars. The healthcare law is a work in progress, but it's already made huge improvements that over time will touch every American family in some way. Next slide, please. The last slide will show you how to learn more. And again, I want to mention at the end what I mentioned at the outset. Please go to healthcare.gov for additional information that could help you with regard to specific questions in any of these areas. Thank you very much for joining us today.
Thank you so much, Susan. That was a very comprehensive overview of the ACA, and it just really really helped bring to light some of the benefits that our community can actually take advantage of. And I really like the slide with the exchanges coverage and affordability program. That graph is great. I've never seen it portrayed that way. But I also just want to highlight the I know that the questions, and it says regional director, that information is incorrect, and we will fix that on the slides that we actually upload to the website, so people will have the correct information for anybody that wants to get in contact with Susan Johnson and also her office.
Thank you.
So thank you so much. Next, I want to turn it over to Reverend Joseph Santos-Lyons, and he represents a community-based organization in Oregon, and he's going to talk about some of how the ACA is actually working in the community. And so without further ado, I turn it over to Joseph.
Hi, everyone.
Doua is actually on the webinar right now. So.
Oh, okay. So actually, I'm sorry, Joseph. Let's Doua.
Great.
Thank you so much for joining. Doua Thor is a commissioner with the White House Initiative, and she will talk about some of the great work that the White House Initiative on Asian American Pacific Islanders is doing. So if you can go back to that slide, the logo slide, Kent. Thank you. So without further ado, Doua, go ahead.
Yeah, can you guys hear me?
Yeah, perfectly.
Hello?
Thank you.
Okay, thank you. And I apologize for being a little bit late. I had a little bit of technical difficulties, but I won't be taking up that much time. I did want to talk a little bit about the White House Initiative on Asian Americans and Pacific Islanders, and thank you to the Health Forum and all those hosting the call, really to bring out this information on what's been going on around the Affordable Care Act. Health is one of the key priorities for the White House Initiative on Asian Americans. A little bit of a background. On October 14, 2009, President Barack Obama signed the executive order which reestablished the White House Initiative on the Asian Americans and Pacific Islanders. The initiative is actually co-chaired by the U.S. Department of Education Secretary Arne Duncan and Assistant to the President Cabinet Secretary Chris Liu, who has also been a strong advocate around many of these issues in different ways. The executive director for the initiative, for those who've not had a chance to meet her, is Kieran Ahuja, and she leads a team of incredible staff who's really been highlighting the needs around health disparities in our communities. A little bit more on the initiative. The initiative itself has 20 different commissioners, of which I am one, which represent different issue expertise as well as different ethnic representation of communities across the country, including Hawaii and the Pacific Islands. So we're really excited because the commissioners bring both a wealth of expert content on issues as well as just connections to different communities across the country. In the last couple of years, the Affordable Care Act has been a really key focus for us, especially around the implementation. We've done a series of discussions in town halls across the country. An example is most recently we did one in Fresno, California, in which that was the first time that the regional office of HHS was able to really connect with communities in that area and come down and really meet them and join the town hall. So we see our role as critical in being able to create those types of opportunities for communities to engage. And we ask that if anybody wants to connect and contact with the initiative, I think the Health Forum team has the contact, and we look forward to hearing from everyone in the community about any issue involving health and others beyond that. So thank you very much.
Thank you, Doua, and thank you so much for joining. I know that sometimes the technical difficulties can get in the way of the webinars being completely on time and whatever else. But thank you so much for joining, and thank you for all the work that the White House Initiative on Asian American and Pacific Islanders does for the community and keeping our communities healthy and the information out there. So without further ado, I'm going to turn it over to Reverend Joseph Santos-Lyons from Apano.
Hi, everyone. This is Joseph with the Asian Pacific American Network of Oregon. We are a statewide community advocacy group that focuses primarily on racial equity and public policy, and have been working on health reform for the past 3 years as one of our programs. So we're excited to be here today. We're a statewide network with over 1,500 members, and we do a range of advocacy work around cultural competency, data collection, workforce diversity, and being able to really integrate health equity into the Affordable Care Act implementation. The next slide, please. So just a quick background. We were formed about 15 years ago. Our vision is to create a just and equitable world where Asian and Pacific Islanders are fully engaged in the social, economic, and political issues that affect us. One of the unique things about our organization, like Asian and Pacific Islanders, is that we have a real diversity of partners who work with us, both within the Asian and Pacific Islander community, which in Oregon represents over 40 different ethnic and language groups, but also with partners across the state, particularly other community of color partners, including African American, Native American, Latino partners. Next slide, please. So just wanted to briefly go over the case for health equity and reform. So the 3 things that we think about as principles. One is that race matters, that there are over 2 million Asian Americans who are uninsured nationally, and as you begin to break down the individual Asian communities, there are higher than average rates of uninsurance. Secondly, that language matters. One of the most profound statistics nationally is that 9 out of 10 English speakers lack proficiency in health literacy. And within our community, where 2/3 are foreign-born and many speak a language other than English at home, we imagine that number is even higher. And so the importance of language and language access is really critical. Third, culture matters. That health access problems are exacerbated in our community because of immigration status, cultural stigmas, and lead often to low utilization of primary and preventative care, and that we need to recognize the role that culture plays when we develop programs in terms of our outreach and the actual quality of care folks are going to be receiving. Next slide, please. So Apano has an ongoing advocacy agenda. Our top sort of priority is to have our health reform start with equity, so to really build in equity from the front end by having clear standards and definitions around cultural competency, accessibility, and affordability. We've worked in the past year to bring our community voice to the table to ensure that health insurance exchange is passed, as well as our coordinated care organizations, which is a very innovative expansion of our Oregon health plan to cover folks who are on Medicare and eventually Medicaid. And then we are doing a range of advocacy work looking at the larger policy environment and systemic changes that will improve the environment for health for all of our communities. And one quick example of that is we recently worked on a successful coalition to bring fluoride to Portland. We were the last major city in the country without fluoride, and this will benefit particularly a number of folks who are low-income and immigrants and refugees who really lack consistent access to good dental care, and also this is an important preventative measure. Next slide, please. So here in Oregon, just a quick snapshot of what's happening is Oregon legislation to create our exchange passed in 2011 that will cover over 600,000 uninsured Oregonians. We also established coordinated care organizations which will cover another 600,000 folks who are on Medicaid. And that the federal government has supported Oregon now with a $1.9 billion grant over the next 5 years to support the development, particularly of our coordinated care organizations. And on a more specific level to one of our advocacy issues, the Oregon Department of Human Services and the Oregon Health Authority have established a new joint race, ethnicity, and language data policy that begins to help us align with the Section 4302 of the ACA around improved data collection and analysis. Next slide, please. So here in Oregon, the reform efforts have extended health care to over 20,000 uninsured Asian and Pacific Islanders. It has created a more diverse workforce that has higher language capacity that ensures that services are accessible. This includes the outreach to get folks to go through the sign-up process, the transition for folks who are on Medicaid who may have speak a language other than English. And then there are both policies and rules being developed that will improve the data collection and analysis, particularly by disaggregating data by race, ethnicity, and language. So all these measures are often still in the pipeline and in the process, but we are working actively not only as staff but with our community members and other organizational partners to track a range of these issues to ensure ultimately that everyone is covered, has access to quality care that is affordable and that is culturally competent. Next slide, please. So just, a couple of highlights about our coalitions. We work as a PANO as a coalition, as a network of a range of Asian Pacific Islander organizations. But then we also have several other regional and statewide collaborations and alliances that help us ensure we are speaking as much as possible with one voice on these issues and being able to participate actively as a grassroots community organization at these policy-making tables. And often, we recognize that we're often one out of 20, members, and often the only non-governmental and non-insurance industry representative. But we know that it's important for us to be working with our partners to be able to make the changes that will improve health equity in the policy-making process. Next slide. So, looking ahead, we're working right now on the Essential Health Benefits Package and Accessibility for Oregon Health Insurance Exchange, which has recently been renamed as Cover Oregon. We are training community health workers who we hope will be hired by the coordinated care organizations. They have a goal of hiring 250 community health workers in the next year. We're also studying and preparing to introduce legislation to establish higher standards around data collection. And we are working collaboratively with Oregon's 17 health licensing boards around cultural competency continuing education for their professionals. Next slide. So we're happy to share information, network with other folks. Love to talk to other state partners who are working from a community level around health reform and health equity issues. And thank you so much for your time today.
Thank you so much, Joseph, for that. Sounds like you guys are doing some great work, and just thank you so much for everything you guys do up in Oregon for the community. And yeah, and thank you so much for taking the time out to explain that and to go through all that stuff with us. So now we're going to move into our question and answer portion of the webinar. And in this portion, I'm actually going to get some help from my colleague in San Francisco to read the questions if there are any. So Kent, do we have any questions for any of the panelists?
Yes, the questions are coming in now. So the first question is, do you anticipate the ACA will cause extreme demands for health care by people covered by other health care?
Ms. Johnson, would you like to take that question?
I wonder if you could repeat it, Franco.
Yeah. Could you just repeat that one more time?
Sure. Do you anticipate the ACA will cause extreme demands for health care by people who are already covered by health care?
So as I understand it, will the ACA drive an increase in demand for access to services is how I interpret that? Yes, we certainly hope so. We hope that those millions of people who have been going to the emergency room will now find their way through the Affordable Care Act and exchanges to actual coverage and to be connected to a medical home and a continuous care team to assist with prevention and whatever kind of medical needs there are. The demand will increase, and the demand will require that we increase both access points through what was mentioned in my part, FQHCs or healthcare clinics, as well as more and more providers needed, especially those, as we've all touched on, will need to be culturally competent and sensitive in their treatment. So I think the answer is yes, and we're stepping up to meet that demand.
Okay. The second question is for Joseph. What are some programmatic measures that your organization has taken to address the social determinants of health, such as intersections between health and housing, health and food security? And how are you measuring success outcomes related to these programs?
Great. That's a great question. So first, we have really worked hard to develop a strong understanding of the social determinants of health among our community members. And so we've gone through now 2 to 3 years of community education. We do the community education through sort of large-scale community forums. We have used the Unnatural Causes film series produced by the California Newsreel and done sort of video showings and discussions. But most importantly, we've done language-specific listening circles and conversations and workshops around the social determinants of health in a range of different languages, targeting communities that are disproportionately affected by uninsurance or health disparities, often refugees and immigrants, and some of the different groups that are English, that have limited English proficiency. And one of the ways we measure success on that level is the number of facilitators that we're training who have the capacity to lead this conversation, and the number of folks who participate and go through and complete a workshop or come to or attend one of our community forums. In terms of actual programs, we don't actually have an ongoing advocacy program or community organizing program, but we have worked with our partner organizations that have launched initiatives around access to healthy foods, looking at issues around sidewalk and transportation routes to school, safe routes to school. And we're beginning to look at some other issues around a soda tax and culture-specific strategies for tobacco prevention. So I know this is a range of sort of both public health and other social determinants of health like transportation issues. But so those are some of the things that we're looking at. And again, in terms of measuring those successes, I mean, we're often looking for not only how much we're at the table, but tracking the folks in our community and preparing and empowering them and putting them forward to represent our community on these different policy tables, but also what the nature of that relationship looks like with local jurisdictions. Are they inviting us into the conversation? Are they engaging us early and often? Are they asking for our advice or our referral around issues? And are they investing in our organization to be able to have the capacity to do this kind of work? And so Apano is a very small organization where our budget is just over $100,000 a year. We only have a couple of staff. You know, we really have to be very strategic with our time and energy at this point. And we're looking at different sort of measures that demonstrate our influence and our power around these issues. And we have partnered closely with various coalitions of communities of color to help make our voice, you know, heard more strongly. And that includes groups like the Urban League of Portland, the Oregon Latino Health Coalition, and the Center for Intercultural Organizing. So I hope that gives you some sense and answer of our questions. I have one great resource that I'd be happy to share, which is a evaluation framework around capacity for advocacy that gives some good indicators that we've begun to use to track our progress and the influence that we actually have here in the state to do some good reflection and evaluation.
Okay,
Joseph, is that
so
something
here's
that we can, sorry, Joseph, is that something that they can access on your website?
Not yet, but we're actually switching over to a new website, so I encourage folks after Election Day to go to apano.org.
Awesome. Thank you so much. Go ahead, Ken.
Okay, so here's the next question. What do you think the odds are for having ACA repealed? How would the proposed WAMI plan affect your current work?
You know, I think that sounds like a question for maybe Ms. David or Ms. Johnson.
Okay, I'm not going to really get into the politics or the sort of magic 8-ball as to what's going to happen post-election. That's really not, I think, possible for me to do. But I can just say that this administration, through the heroic efforts of putting this Affordable Care Act into place, will never stand for it to be repealed. And you've heard this president say that and this secretary say that time and time again, to resist efforts to water it down, to dilute it, to shave off parts of it. In fact, it's recognized that there are parts that need to be improved and holes that need to be filled. So with this administration in control, the Affordable Care Act and the promise that it brings to millions and millions of Americans through 2014 and beyond will stay. The repeal will cost individuals hundreds of dollars. If you just look at Medicare, the repeal of the Affordable Care Act will take with it the Medicare improvements that allowed seniors to have those preventive services without copays and deductibles, that allowed them to have prescription drug assistance for the donut hole. All those kids also allowed to stay on their parents' insurance. With the sweep off of the Affordable Care Act and its repeal will now be uncovered. I don't think any of us know, quote, what a Romney plan is, but we know the reality and the traction that the Affordable Care Act has provided in just 3 years. And we know what it will provide to millions of more Americans and the lives that it will save going into 2014 and beyond.
Great, thank you so much. That's a great answer on the policy implications, and I think definitely sums up the impact that the ACA actually has, and then what it would actually do to our communities if anything else would happen to it. But I think we are at the top of the hour or coming close to it, and I would just like to thank everybody who's joined. this webinar today, taking the time out of your busy day to learn more about the ACA, but also want to thank our panelists who have taken the time out to explain more about the Affordable Care Act to us and all the things that they do for our communities and keeping us all healthy. So I will go ahead and end there, and sorry to any questions that we didn't get to. We will try to get to them through email and follow up with you, but please check our website for the recording and also the posting of the presentation itself after it's been cleared by HHS and also the White House Initiative. So thank you very much for everybody for joining, and have a great weekend.
Thanks for all you're doing. Thank you.
Thanks, everybody. Take care.